Hello and welcome to the Lynn Lowdown. And today we are joined by Lynn Community Health Center physician, Ms. Catherine Reyes. How are you doing?
I'm doing well. Thank you so much for having me on the show.
No problem. Thank you for coming on. There's a lot of things happening as far as vaccines, health, and you know, the timeline. We're here in 2021 and everyone's getting vaccinated, and Lynn Community Health Center is a vital place for vaccination. So just before we get into everything, just quickly, just tell me about the first couple months of this new year. How's everything been going? Since vaccines started rolling out and all this COVID stuff started to calm down.
Absolutely. So it's been really exciting, I think, for a lot of us healthcare providers that were able to be vaccinated at the very beginning of the year. And we can finally start to go like, whew, a little bit like we have much less risk of getting infected ourselves. And maybe we feel more comfortable now with our families and sometimes going out into the community and doing a lot more community outreach. And then starting in early February, patients started to be vaccinated initially by age, and people who also work in healthcare, including personal care attendants. So that was wonderful that it wasn't just like nurses and doctors at the hospitals and clinics, it's everybody that works in healthcare. So that's been really exciting.
Mhm.
But the challenge has been to get people out to get vaccinated, especially people for whom like English is not their first language, or they
Mhm.
don't feel super comfortable making appointments online, because so far to get vaccinated, you have to have an appointment for most locations, and
Mhm.
those appointments have been made online. And there's a lot of people who are a little bit older, or again, English is not their first language, and they don't feel comfortable, or sometimes like sharing that information online, say for people who are maybe like undocumented or like recent arrivals to the US, don't always feel well sharing that information, not being sure where it goes.
Yeah, and there was a point. I think there was a point where, or a day or two, when you all had made it available for people to come and get vaccinated. There was like a day or two for non-members or something like that. Am I correct?
We did have a couple of times that we were able to do exceptions where the
Yeah.
state hadn't
Okay.
yet moved
Mhm.
that to like the next phase,
Yeah.
and we just had a lot of open appointments, so we were able to get people who didn't quite yet qualify by the state to
Mm-hmm.
come in and get vaccinated. But it really lasted like a few days or maybe a week, and then
Mm-hmm.
the next priority group opened up, and then
Mm-hmm.
there's a lot of people that needed appointments, so we could no longer use those exceptions.
Okay, I gotcha. Yeah, because I remember there was a massive text or email that went out to residents about that. I mean, and that's one thing the community health center has been doing a good job of, is the communication with the community and keeping them informed or updated of what's going on at Lynn Community Health Center, and what the phases that Lynn Community Health Center is at as far as getting people vaccinated as part getting people to come in, just people that usually regularly comes in. That's one thing that they've been doing a great job of since last year.
Thank you so much.
Yeah.
Thank you. And it's there's still always some barriers. The priority by the state, we have to follow very
Hmm.
closely, because we get a lot of our supply for vaccine from the state,
Hmm.
and at times there's been very limited supply. And thankfully, we're starting to have more supply
Hmm.
on a steady basis and not running into that challenge. But the different priority phases have made it confusing for people at times, because for instance, there was a time when like people could qualify if they had two medical conditions, and then
Hmm.
a lot of people are like, great, I have high blood pressure and I have high cholesterol, those are two, right? And we're like, no, it's actually from a list that are like 10 things like diabetes, obesity, smoking, cancer. But the wonderful news is that starting on Monday, the 19th of April, actually the qualifications open up for everybody in the state of Massachusetts who is 16 years old and older who wants to get vaccinated. Again, it's not a requirement, it's not
Hmm.
being made required, but it's strongly recommended, because this is one of the key tools that we have in our toolbox right now to start getting back to normal, to be a lot safer, for the community to open up,
Hmm.
and to really start to decrease the rate of infection, especially as things like variants come up that sometimes can be transmitted from one person to another a lot more quickly. The faster we can get the vaccination into the community, the safer we are going to be all together.
Now with the 16th, everything's open up. What are the doses that you guys are handing out? I know they're right now they're doing the Moderna doses where it's a one shot. But can you tell everybody what the process for Lynn Community Health Center is as far as doses and on the vaccine?
Absolutely. So I'll step back just a tiny bit in terms of like who can get vaccinated through
Yes.
Lynn Community Health Center and the city of Lynn. We are currently not vaccinating at the health center directly.
Hmm.
We have a coordination and a wonderful effort between the city of Lynn and Lynn Community Health Center with some support also from Mass General Brigham. And we're vaccinating at the Lynn Tech. That's the main location. Whenever we're doing it at the main location is going to be at the Lynn Tech on 80 Neptune Boulevard. And that has to be by appointment. People have to make an appointment to be able to go there and get vaccinated. And starting on the 19th again of this month of April is going to be anybody who is 16 years or older. We won't have to worry anymore about whether we are essential workers or whether we have medical conditions or what age other than 16 and up. So it'll get a lot simpler. We do usually have three different vaccines, which are the ones that are approved in the United States currently. What's tricky is that we don't always know which day we're going to be giving out which one.
Hmm.
So most of the time we're not able to let people pick. And I know that can be frustrating, but right now, one of the most important things really is to get vaccinated quickly to
Hmm.
begin getting protected. It's not so important to pick one specific vaccine, except when it is really important to pick one specific vaccine is for people who are 16 and 17 years old. There is only one approved vaccine for 16 and 17 years old, which is the Pfizer brand. So the scheduling for 16 and 17-year-olds is a tiny bit more restricted because there's only some days that we know for sure we're going to have Pfizer, and we want to make sure we put them in that spot. Also, if anybody is 16 and 17 years old who is going to get vaccinated, they are legally considered minors. They cannot sign their own consent papers, so they have to go with a parent or guardian. That's also really important. But in terms of the other vaccines, the Moderna and the Pfizer are the two that actually require 2 doses. So you get the first one on that first day when you have your first vaccine. And while you're there and you're going to get your first one, you will be given an appointment to come back in either 3 or 4 weeks for the second one. So you don't have to like call back and make a separate appointment. No, you'll get the appointment on that same day, and it's usually on the dot. 3 weeks out if it's the Pfizer, because that's the interval that it's recommended, that was studied, and 4 weeks out if it's the Moderna, because again, that's the interval that has been, or the kind of period of time in between 1 and 2 doses that has been studied, that works really well. And after we get that second vaccine, about 2 weeks out is when we'll expect to have the best protection, which looks like maybe somewhere up in the 90s from getting ill, and even potentially higher protection from severe illness or from dying from COVID, which are some of the things that we worry about the most. So the protection is looking really good. And then the other brand of the vaccine, which is the Johnson & Johnson, or also has the name Janssen, that's the one that's a single dose. And that one, it's really nice to be able to use it for certain events as we are starting to go out of, we don't expect everybody to be able to go to Lynn Tech. It can be a little bit complicated. We're open usually Monday through Saturday, and we do have a lot of evening hours that go as late as 7:30, and we usually start appointments at like, I think 8:15 or 8:30 in the morning. On Saturdays, we usually go from 8:30 until about 1:30, but we're not open Sundays there. And there's some people for whom the only day that they reliably have off is Sundays. So for some people, we do know that they're not going to be comfortable, or it's not going to work with their schedule to go to Lynn Tech. So we're starting to do a lot more mobile vaccine. And that means we take some vaccine with a crew that's ready to do it and that can register and track people. And we take it to different locations. So we can take it sometimes to food pantries. We can take it sometimes through churches, which is one of the big ones that we're doing right now. Work sites. And so some of those are being done by Lynn Community, some of those are being done by the city, and there's a lot of coordination between the two and a lot of support and back and forth with each other. So for the past, I want to say almost a month, maybe 3 to 4 weeks, we've been going to a couple of the churches in Lynn. And recently we did one of our largest events at Visión Cristiana, and we were able to vaccinate just under 200 people. And it was a big success. We want to make it bigger. We want to make it very accessible. When we go to those events, most of the time we do the Johnson & Johnson. So that's usually one of the only times that people kind of can really pick, or like know most of the time that is what we're going to have. And one of the reasons is because we don't have to worry about all of the logistical piece of making sure that people come back or that we can get them in exactly 3 or 4 weeks afterwards. And
Okay.
the Johnson & Johnson vaccine is also very effective, very safe. When people look, if there's some kind of numbers people in the crowd and they look at some of the numbers of protection from the Johnson & Johnson vaccine, the numbers can look a little bit lower in terms of protection, somewhere in like the high 60s or 70s. But it's important to recognize that the Johnson & Johnson vaccine was studied when there were a lot more mutations out in the community in different countries around the world. And the mutations can make it challenging for vaccines because we don't always know if we're going to be fully protected from certain mutations. And so even though the numbers sound a little bit lower, it actually, the protection from severe illness and from dying from COVID was still really, really high. And it's a great option as a vaccine. So it's not so important to pick something, but to get vaccinated as soon as possible. And for some people, just a one shot, especially if they're really afraid of needles or, you know, they don't feel like making an appointment and they just want to go to an event that's happening at a church or at work, it can be just a fantastic option.
And what do the people need when they go get vaccinated, when they do make the appointment? What are the important stuff that they need to bring with them?
So the main thing is that, so for the most part, you don't need to prove anything because we want to, the vaccine is free. So even people who don't have health insurance can get vaccinated. Even people who don't have a driver's license can get vaccinated, because it's really important to get as many people in the state and in the country and in the world as possible. But right now, Massachusetts does not require people to show proof of most things. It's good if somebody has an ID or something that shows the town where they live in, be it like a bill or something that shows it. Most of the time, they're not even going to be asked to show it, but there will be some questions related to, you know, their address, and if they have health insurance, if they can provide that information. But if they don't, that's okay. One of the reasons that we do ask where people live or work is that different locations, like the Lynn Tech location, try to reach a certain community. So for instance, at Lynn Tech, we're able to vaccinate people who live or work in Lynn or Nahant, or who are patients of Lynn Community Health Center. So for instance, if we have other people who are from the North Shore but are not patients of Lynn Community Health Center and do not work or live in Nahant, then unfortunately, we're usually not able to vaccinate them at the Lynn Tech. And it's not because we don't want to get them protected, it's because different locations have limited supply and limited staffing. And so we're really trying to help the local population that maybe has a really hard time finding transportation to another town. There are some locations in the state that take anybody from anywhere in Massachusetts, but the Lynn Tech is not one of them. We really want people to be people who live or work in Lynn or Nahant, or who are patients of Lynn Community Health Center. At the churches, we also are vaccinating some people who come regularly to the churches, because, you know, even if they are from a little bit different location, but they're usual regular members of the church that are coming in to get vaccinated, then it's really important to get them protected, because that's how we get that community protected. So there might be sometimes a little bit more leeway, but definitely for the Lynn Tech, and it's not like a huge amount of leeway. So I also don't want people who like have never been to the church go to the church just to get vaccinated, because we really need to help protect the local community and find those local resources as much as possible. But at the Lynn Tech specifically, also, we are very, very strict about that piece. We really have to serve the local community.
Gotcha. And can you tell the people what time the vaccine clinic at Lynn Tech is open until?
Okay, excellent question. So the times can change a little bit from week to week, because it depends when they open appointments, depends a little bit on staffing, but mostly on vaccine supply. But in general, we have been open from Monday through Saturdays. We're usually not open any Sunday at the Lynn Tech site, but from Monday through Saturdays. On Saturdays, it's usually appointments 8:30 until about 1:30. And from Monday through Fridays, it's usually about 8:30 until 4:30, but there's a few days a week, sometimes 3 or 4 days a week, that is open until 7:30. But again, it has to be by appointment. So it's whenever the appointment time is given, people should make every effort to be there just around time for the appointment, because for a couple of different reasons, because especially like if they're coming in for a second dose, we want to make sure that we have enough of that vaccine at that point. So if you have an appointment at 9 in the morning and you show up at 1 in the afternoon, we may not have that specific vaccine anymore because we only had it for the morning. So
Gotcha.
it's important to go around that time.
Uh-huh.
When we're doing some of the mobile visits, some of the mobile locations, some of the times people don't have to be pre-registered. They can just show up, but we usually only promote it through word of mouth, through like the church itself or the work site location. So often we won't necessarily have that information up, like say on social media way ahead of time. That's usually word of mouth through that organization.
Gotcha. And lastly, could you just tell everybody where they could go to find the information, the website, all that good stuff?
Absolutely. So one really exciting piece of information is that the Lynn Community Health Center main phone number has now added staffing to be able to answer phone calls very specifically about the vaccine and to help people make appointments. So that's huge. That's a big difference. We didn't have this resource before. So now people who are eligible again to get vaccinated through this joint effort through Lynn and Lynn Community Health Center can call the main health center number 781-581-3900 to schedule an appointment. And there is also a separate phone number that will take you to the same location. And that number is 781-595-7747. But those people who are already part of the community health center know the main number. They can call the main number. And if you're not a patient of the Lynn Community Health Center, but you live or work in Lynn or Nahant, you can call that number to schedule an appointment. We do ask that people who are not patients of Lynn Community or do not live or work in Lynn, please do not use this resource because this is only to vaccinate those local people. So even if they call to ask for information and they are not one of the people that would be eligible to get vaccinated there, they're not going to be able to get an appointment. Or even if they make an appointment kind of accidentally, when they get there, there's a very high chance that we're gonna turn them away because it's at the wrong location.
That's it. All right.
And the website, you asked me about the website.
That's
sorry, because
the website
that information is still up. Absolutely. So there's a couple of ways to get to the information on the website. So if you just like do a search through like Google or whatever search engine for City of Lynn, then you'll get to the main City of Lynn website. And you can click on the link for COVID vaccination. Or same thing through the Lynn Community Health Center website. You can do just a quick search, Lynn Community Health Center, and it will come up. And the other, the full address is the HTTPS, //www.lchcnet.org. Okay, so that the www.lchcnet.org, that is the website for Lynn Community Health Center. And people can also search up there and set up an appointment, but they can also call, which works well for a lot of people, and it's finally going to be up live.
All right, Catherine, thank you very much for all that information. This is very important stuff that people need to know, and we really appreciate you coming on and telling us all about that.
Thank you so much for letting me share this information. I'm so excited about the resource, and I hope that a lot of people feel comfortable getting vaccinated so we can get protected. And if you don't feel comfortable and you want to talk to your provider, you want to come to one of the events to like hear a little bit more about the vaccine and kind of help make up your mind. We are trying to go through some of the job sites and also answer questions, or some of the church events and answer questions, or through your regular primary care provider.
All right, and there you have it, ladies and gentlemen. That is Catherine Reyes of the Lynn Community Health Center. Make sure you visit the website and call the number if you want to get vaccinated or want to get information. You guys have been watching the Lynn Lowdown. Have a great day.